morning and welcome to Village in Motion. I'm Marcia Boyles and I'm delighted this morning to begin with by introducing Dr. Dar, who probably doesn't need any introduction. Dr. Dar is the head of our medical center. And Dr. Dar, I'm going to let you introduce your guest today, who I understand is a brand new employee of the medical center.
Yes, and I'm very delighted, and first of all, thank you very much for introducing me, and I'm happy to be here. And I'm extremely delighted to introduce one of our newest member of the medical team, Kaleem Kauser. She is a nurse practitioner who joined us recently, and she has almost completed her orientation here, and now she's working full time.
So you've just been here a few weeks.
Yes, this is my 4th week.
Your 4th week, okay. All right, so you're now working full time?
Yes.
Do you want to tell us a little bit about your background?
I got my RN degree from Exocel College, which is a military college in New York. And after passing my NCLEX exam, I work as an RN a few years before, and really there are a lot of the options for me to go. So I choose to be a nurse practitioner, so I can work. I specialize in family practice, so it's a good area for me to work, seeing the populations, and it's a broad field for me to work. So this is my RN for many years, and then a nurse practitioner degree from Walden University. So
From
this
Morgan?
is Walden.
Walden.
Is W-A-L-D, Walden University, and I'm happy to be here, and thank you for me to invite over here.
Well, we're delighted to have you, and I'm sure the medical center is extremely pleased to have you.
Oh, thank you.
Colleen, tell us the difference between a regular RN and a nurse practitioner.
Nurse practitioner and RN, they both have their scope of the practice determined by the state board. So in Virginia, it's in a RNs can have their scope of the practice. They work, but they need to get the orders to follow, and there are the different areas for the RNs to work. The biggest difference between nurse practitioner and RNs have the broader scope of practice as compared to RN, and they also have prescriptive authority in the state of Virginia.
Oh, they do?
Yeah, so, and they work in collaboration with the medical doctors. RN degree is being provided by the Board of Nursing, and nurse practitioner degree is a joint degree from the Board of Medicine and Board of Nursing. So that's the biggest difference. So when you'll be certified from the Board of Medicine and Board of Nursing as a nurse practitioner, your scope of the practice is widened and big enough to work in different areas of the healthcare.
Is that a BS degree or an MS degree?
It's a master degree.
It's a master's degree. Okay. Yes, that certainly helps clarify it. What kinds of patients do you see as a nurse practitioner?
In this facility, I got a very good orientation at the medical centers where people comes for follow-up or as an acute need. In the admitted patients, we have a different kinds of the peoples like follow-up, long-term cares, and SNF, which is a skilled nursing care. So,
do you also go over to Garden Ridge?
Yes, I'm in the Garden Ridge. So
you're in both Garden Ridge and in our medical center?
Yes.
Most of the time she is rotating in Garden Ridge, and you know the Garden Ridge is divided in skilled care facility and assisted living facility and the long-term care facilities. So she is currently dividing her time between skilled care and long-term facility and spend some time in the medical center. Once she is fully oriented, then probably we will be able to use her expertise more frequently in the medical center also. But
do you have a nurse? Do you have any other nurse?
We have another nurse practitioner, Kaveta. She is working full time. and we unfortunately lost one nurse practitioner.
I thought you had.
And she replaced her.
Okay, all right.
And I think we have a very good replacement, and probably she will be a great asset to our medical center.
I can believe that. Dr. Dar, are you fully staffed these days in terms of physicians?
We lost one physician,
Yes,
so
Dr.
we are
Pham.
working with one less physician. So I
Are
can't
you,
say that
are
we are
you
fully
trying
staffed.
to replace him?
Yes, we are. We are, but it's hard. It takes some time.
I can imagine. I can imagine that it is.
So as soon as we have somebody, then we will be full time.
So
But regardless that we are one less physicians, our physicians are working extremely hard.
That's what I understand, yes.
And we are not letting any loose holes here. We are dedicated. We are doing all the services to all the physicians, and we don't feel any overstressed because of one less physician at
You
this
don't
moment.
feel stressed?
I think we have absorbed our responsibilities. This is our responsibility, so this is no pressure. It is responsibility.
And probably a little pressure, I would guess. Oh, all right. But what you're saying is you're covering well.
Yes, yes.
Until you find somebody. Are you interviewing?
We don't have any candidate
Don't have any
for
interviewees?
interview now.
So it's going to be a while, I
Yes,
think is what
yes.
you're saying. What else is going on that you would like to talk about this morning?
Well, I will like to review that whenever a patient comes to the medical center, please bring their Medicare cards.
That's some of us have not gotten them yet.
And we
Have most people gotten their
yes,
new ones?
most of them, and they are bringing it regularly. But this is a reminder that don't forget,
Yes.
bring it.
If you've got it, bring it.
Yeah, and it's helpful to up-to-date your record. So this is one thing. Second thing is, if you have any problems, don't hesitate to call us, and we will try to see you as soon as possible. But if we are not able to see you, we will definitely do evaluation whether you need to be seen right away or no.
You mean on?
In the medical center.
All right. Do you mean by phone, or when you say?
If you have any problems and you don't have an appointment, call us. That if you can be seen, we can evaluate whether you really need to be seen right away. If not, then we can give you another appointment as soon as possible.
Or send you to the ER or
Yes,
something.
yes,
Right.
we will take care.
Okay. All right. So people shouldn't hesitate to call.
Yes.
And the fact that you have a 24-hour, you're on call 24 hours.
Yes, we are in the facility till 5 o'clock. After 5 o'clock, there is an on-call doctor. So if someone have any problem, they can talk to the on-call doctor. They can call the telephone front desk and ask for the on-call doctor.
I've always been impressed, Dr. Dar, with the quickness with which your calls are returned on weekends or in the evenings. I mean, it's 5 minutes, 10 minutes. It's very quick, which I think is impressive. A question occurred to me, and you may or may not have these figures at your fingertips. What percentage or how many independent living residents use the medical center?
I think we are around 70% plus.
Is it that high? I would have guessed maybe 50%. So
No.
70% is okay.
But we love to have 100%.
You would? Well, now, presumably only after you get another physician.
We will.
All right, 70. Now, is that up a bit?
Yes, there is a little bit improvement, and we did, welcoming
The meet and greet?
meet and greet, and a lot of new residents showed a lot of interest. So we are
Crystal
hopeful.
said you had picked up 30 or something. She
Yes.
said folks from that, which turned out to have been a really good thing, wasn't
Absolutely.
it? No, that was an excellent idea. All right, so it's more than 70%. I think that's very impressive, and certainly I think, and I clearly I could only speak for myself, but I think there certainly is a greater degree of comfort, I think. Favorable reviews maybe would be one way of putting it of the medical center these days. I mean, we're hearing positive reports.
That's we are really appreciative for all those patients who are sending those reviews, and this is our job and responsibility to act better and improve our standard every day.
Yes, absolutely. No, I don't say that lightly, Dr. Dar, because there were certainly years when that was not the case. And I'm not telling secrets out of school here, I think. No, that's very helpful. Anything else? I see we've got maybe 2 minutes here.
I think I would like to say that it's a hot season. It's a hot and humid season. So please be careful when you go out. And I request all the physicians that be hydrated, drink a lot of fluid, cover your head with a hat or anything, and try not to stand in under the sun. Keep yourself under shade.
Mad dogs and Englishmen in the midday sun. Yes, all right.
And if you feel tired, fatigue after a walk outside under the sun and feel very dry and hot, come to the medical center.
Okay, all right. Now, I don't think most of us honestly would have even thought about that.
Yeah, and one more thing is that because sun rays radiations is sometimes toxic to the skin, so whenever you go outside and you plan to stay outside for a long time, 2 things needs to be done. One is the sunscreen and the insect repellents. We don't want you to have Lyme's disease or gnats biting you and developing a rash.
And there certainly are ticks in the area.
Absolutely.
Those of us with
Ticks,
animals.
mosquitoes.
Dr. Dar, one last question. Are there any new specialists coming into the medical center that you're aware of probably coming in?
We are waiting for the cardiologist. He was supposed to start in July. And
What is his name?
his name is Tariq Shahab. He's a interventional cardiologist. The interventional cardiologists are the doctors who are
Intervention?
intervention.
cardiologist?
They are the doctors who are not able to do only the medical care of the cardiac issues, but they can do the intervention, like they do the cath, they put the stents and all those procedures.
All right. Okay.
Yeah.
I wasn't sure what that term meant.
He is supposed to start in July, and I am hopeful that there will be nothing stopping him.
All right. Good. Yes, we've certainly been without one. Now, do we have a dermatologist these days?
I don't think we have a dermatologist at this.
Okay.
in
I
these
think
days.
that was one that maybe Crystal was trying
Yeah.
to work on as well.
We wish we have all the specialities.
I can
here.
imagine. Yeah, it's difficult. It's difficult. Okay, anything else? Well, we're glad you're here.
Oh, thank you.
And good luck. We'll probably see you again in the future at Channel 6.
Sure.
Dr. Dar, thanks so much for coming
you
in
very
today and getting a report. This helps.
Thank you very much.
Thank you very much.